Guys, look at this question here. Mention common causes of delirium in adults. Delirium in adults, common causes, and briefly describe its clinical features. So they're asking about delirium. Okay. What is this delirium? It's more like a confusion state. Okay, delirium. So delirium is what? Confusion state. So remember, this is a temporary state. It's an acute condition. Okay, confusion state. Okay, so postictal delirium means postictal confusion. That is, after a seizure, somebody can have confusion. Confusion. Why does it happen, and what are the clinical features? Okay. So first we will say what it is. We will say it is a cortical dysfunction. So acute confusional state, earlier it was earlier called as what? Acute confusional state. Now they're saying it is acute cognitive impairment. So that is why you'll always check if the person is oriented to time, place and person, right? So this can be precipitated because of illness or surgery. 25% of all hospital inpatients will suffer from delirium. Okay. So we can say this is a psychiatry topic, guys. And if they are saying if the person has delirium, they are saying that it can be a bad prognosis kind of a thing. Okay. So you should understand what is delirium, which they have asked in this exam. Delirium versus dementia. Okay. In both of them, there is confusion. But dementia is something which is a chronic state. Okay. Dementia is what? Chronic. Okay, dementia is chronic, progressive. This person is chronically confused, etc. Delirium is what they're asking in this. This is an acute condition. Okay, acute confusional state. Okay, cognitive impairment, acute cognitive impairment. Acute is the word that you should know here. So the change is hours to days. So if this person was fine, but in hours or minutes or days, this person is having some kind of confusion. Okay. So this person can be deficit in attention, they can have lethargy, they can be sedated, like kind of a thing. So if there is hypoactive delirium or hyperactive delirium, lethargy, sedation, hyperactive delirium, restlessness can be there. Okay. So this person is confused. That's what I'm trying to tell you. Clinical features we are telling you at the moment. Causes we'll go to later. Okay. So how will you know a person is confused? Right? So that is a 4A test. Okay, this is a 4A test. This is a for delirium 4A test. So the first one is alertness. You will ask the person their name. Are they alert? Are they awake? Okay, alert. Then abbreviated mental test. Okay, abbreviated mental test. You will ask them their age, date of birth, where they are currently. Okay, orientation to time, place, person kind of a thing. The current year you are asking them. Okay, this is the second A they are saying in the 4A's. Then attention. Alertness, abbreviated mental test, then attention. Attention is ask them to say the names of the months backwards from December, or you can ask them what comes before December, November they should say. Okay, and then you score them. Then fourth one, we are not going into much details here, but you can understand the fourth one you will write is acute change or fluctuating. So they are very fluctuating. There is change in this person. He was fine now he's not fine. Paranoia, hallucination, something is happening. Okay, fluctuation is happening. Fluctuation is not a good thing. Okay, based on that the score they are giving. And if it is greater than 4, okay, if it is greater than 4, they are saying the person has delirium. Greater than or equal to 4, person has delirium. Maximum it can go up to 12. So greater than or equal to 4, they are saying possible delirium. This is the 4A T score, right? 4A test, 4A score, 4A test score. Okay, if it is greater than 4 only, it is or equal to 4, it's possible delirium. Okay, possible delirium. Okay. See, sometimes the patient may not be able to answer, so it could still be a delirium, right? You should understand that. And sometimes maybe the patient really didn't understand you at all, right? They don't know what comes before December. So you should keep all that in mind, okay, guys? Just know some other terms. Delirium tremens is given when there's alcohol withdrawal, okay, guys? Severe alcohol withdrawal with tremens means what? Tremor, sweating, tachycardia, all this, okay? So delirium tremens is a specific type of delirium, you can say, okay? And you should differentiate it from hepatic encephalopathy. The other DDs you should know for delirium are dementia. Dementia, I told you, is a chronic condition, progressive loss of function, okay? And schizophrenia also you should differentiate delirium from. Okay, in schizophrenia there will be visual hallucinations. Okay, so DDs also we have told you. So all the clinical features, DD, everything we have told you. Now let us go to the causes and treatment.
4A test.
Yeah, how do you diagnose delirium?
4A test.
Yeah, 4A test. Very good. So that will have alertness, abbreviated mental test, attention, acute change. Okay. So now let us go to the first part of the question that they have asked. Causes. Okay. Causes of what? Delirium. See, common causes of delirium they have asked. Actually, common causes they have asked of delirium in adults. Describe its clinical features. Clinical features and all we have finished. Now let us go to the causes and the prevention, treatment, etc. So this person can have an infection which would have become sepsis. Okay. So life-threatening condition that can cause delirium, sepsis, drugs, some drugs like benzodiazepine, anesthetic drugs, etc. Many drugs are there we'll tell you. Alcohol intoxication or withdrawal, we told you delirium tremens. Hypoglycemia, there is a low blood sugar, glucose, other metabolic disorders. Okay. Frailty, this person is so weak, old, if there is even constipation or if there is a urinary catheter that is enough to cause delirium. So guys, are you focusing here? Frailty, constipation, urinary catheter also. Okay. Next, let's go here. Okay, so sepsis infection we told you, right? Infection like COVID, etc. Any infection for that matter, pneumonia, lower respiratory tract infection because of which there will be acute breathlessness. Pain itself can cause delirium. What can cause delirium? Pain itself. Drugs like benzodiazepine, anticholinergic, SSRIs which will increase serotonin or anything else that increases serotonin can cause delirium. Opioid analgesics, example morphine, haloperidol itself can cause delirium, but haloperidol is the treatment for delirium, interestingly. Quinolones, fluoroquinolones like your ciprofloxacin, right? All those are quinolones. See here, ciprofloxacin, levofloxacin, right? All these. Piperazine, which is used as an antihelminth, glucocorticoids, anticonvulsants, tricyclic antidepressants like your amitriptyline, right? So here you can see under antidepressants, tricyclic antidepressants, they're talking about like example amitriptyline, etc. Okay. If you have given them ketamine, anesthesia, all this. Okay. So all the drugs we have covered, guys. Now let's go to the other causes. Now, if the person is in intensive care for a long time, ICU care for a long time, they can have delirium. Palliative care, if they are hypoactive, if they are over sedated, if they have old age, frailty, sleep disturbance if they have. Okay. So all this you will write. Next, alcohol withdrawal can lead to what? Delirium tremens. Very good. Now talk about some malignancy, neuroleptic malignant syndrome, hypercalcemia of malignancy. Okay, malignancy, hypercalcemia. Then increased intracranial pressure, seizures, even before they can have a delirium, even after the seizure, they can have a post-ictal delirium. Okay, head trauma or a stroke has happened. Okay, everything you're blaming the brain here, intracranial pressure, etc. Then you can blame the heart also. Low cardiac output, myocardial infarction also can cause what? Delirium, guys, delirium. Yeah, so much of delirium. Now coming to pregnancy, they are saying if there is preeclampsia, that is just before the seizure attack, right? That is what you call preeclampsia. Eclampsia is the seizure part, right? So there also there can be delirium, and puerperal psychosis, that is after childbirth, they can have delirium. Okay, confused state, acute confusional state, cognitive impairment, acute cognitive impairment, cortical dysfunction. Guys, now let us go to the prevention and the treatment. Guys, prevention, what they are saying is when the patient is in hospital, right, uh, you should check if they have constipation, you should avoid urinary catheters, etc. Okay, then you should give them fluid, hydration, nutrition, etc. So you should not let them become dehydrated. Then you should provide clocks and windows. They should know whether it's day or night. No, so you only should provide proper windows and clocks so that they know whether it's morning or night and what the time is, etc. And you should have some cognitive stimulative activities. Go and tell them good morning, like that. And you limit ward movements. Okay, don't move them from one ward to the other ward to the other ward to the other. They forget where they are, which floor. And early mobilization, they should not be always sleeping, right? Mobilize if possible, that's what they're saying. Medications, if there are some medications you think are causing the delirium, okay, then you can reduce it or stop it. Sleep disturbance should not be there, so you give them some noise reduction earplugs, let them sleep. Non-pharmacological sleeping aids you can give them. Then you give them hearing aid so that they can hear what is happening, large text so that they can read also, right? A calendar with big fonts. Today is what date? Diwali. There is some help hospital elder life program they are saying. I'm not sure if it is in India. One more point you can add here is a day night routine that you can add for the person. Switch off the lights, let them sleep, tell them it's night, sleep, wake them up in the morning, good morning. Same thing I'm telling you again. Okay. So non-pharmacological is the treatment they're telling. Okay. Then what are the pharmacological treatment? Low dose antipsychotic medication, haloperidol, olanzapine, quetiapine. Okay. So where is haloperidol? Haloperidol is here. Can you spot it? Haloperidol. We're talking about treatment for what? Delirium. Haloperidol, olanzapine and quetiapine they are talking about. Okay. So olanzapine, quetiapine, atypical antipsychotics, they seem to like this more. Okay. Than haloperidol, which itself can cause some, what do you say? A delirium. We're talking about delirium. Okay. So they're talking about what is the treatment for delirium, non-pharmacological, pharmacological, olanzapine, quetiapine. Okay. Which are atypical antipsychotic. Okay. Olanzapine, quetiapine may be indicated. Okay. What else is there to learn, guys? If the person is having this alcohol problem, no, then you have to give thiamine. Okay. This also you have to write in treatment. This is pharmacological only, right? So you will write thiamine, okay, thiamine, that is vitamin B1, okay. If they have Wernicke's encephalopathy, alcohol withdrawal syndrome, basically, delirium tremens. So common causes of delirium in adults and briefly describe its clinical features, even treatment we have covered, okay. Bye-bye.